Hi guys, once again it's me Nathalie Kate. Today we're going to learn about the COVID-19 or coronavirus disease discovered in 2019 which is responsible for the global pandemic. So what is the coronavirus? Coronavirus are a large group of viruses that are covered in little protein spikes on the surface. And this gives it an appearance of a crown. Crown in Latin is called corona, and that's how these viruses got their name, because it refers to the way that the virus looks under microscope like there's a crown on top of the virus. There are different types of coronavirus that cause illness in humans and animals. Coronavirus can cause respiratory infections in humans, ranging from the common cold to more severe diseases. These include the severe acute respiratory syndrome coronavirus or SARS coronavirus, first identified in China in 2002. The Middle East respiratory syndrome coronavirus or MERS coronavirus that was first identified in Saudi Arabia in 2012. And there are actually a lot of other types of coronaviruses, but they don't have special names. And they just cause the common cold. The virus that we are dealing with right now is called SARS-CoV-2 or Severe Acute Respiratory Syndrome Coronavirus 2. The name of the virus that causes COVID-19 that was first reported in China in December 2019. So where did this virus come from? It is known that coronaviruses are common in certain species of animals. And sometimes this virus can make the jump from animals to humans. And this could be due to many factors such as mutations in the virus or increased contact between humans and animals. Like, for example, the MERS coronavirus is known to be transmitted from camels, and the SARS-CoV is known to be transmitted from civet cat. While the new coronavirus, which is called the SARS-CoV-2 or Severe Acute Respiratory Syndrome Coronavirus 2 that causes COVID-19, is also believed to have zoonotic origins like other coronaviruses and has close genetic similarities to bat coronavirus, suggesting it emerged from a bat-borne virus. How does the disease spread? COVID-19 spread from person to person through droplets. When an infected person releases those droplets through coughing, sneezing, or talking, it can also spread when infected droplets land on objects like, for example, a doorknob. And when another person touches them and then touches their eyes, nose, or mouth, most people have only mild symptoms or even none at all. Common symptoms include fever, fatigue, and respiratory symptoms such as cough, sore throat, and shortness of breath. And some people reported loss of their sense of taste and smell, and some may develop a skin rash. And in more severe cases, they develop pneumonia, organ failure, or sometimes death. There are some people who are at risk of serious illness, like the older people or people with underlying medical problems such as chronic respiratory diseases, obesity, diabetes, high blood pressure, heart disease, or cancer. And now, how do we prevent the transmission of the virus? There are a number of effective ways on how to prevent the spread of the virus. And these are to cover your mouth and nose when coughing or sneezing with a flexed elbow or a tissue, and immediately throw the tissue in a closed bin after use. Wash hands regularly with soap and water or an alcohol-based hand. Maintain physical and social distancing of at least 1 meter apart. Another is the appropriate use of face masks and personal protective equipment, especially in healthcare settings. And the last one is stay home if you're feeling unwell, and to call a hotline or seek medical care early if you have cough, fever, or difficulty of breathing. So that's it, guys. Please like, share my video, and don't forget to subscribe. Bye bye!